अस्सलाम वालेकुम जी, दिस इज़ डॉक्टर नूर रहीम और आज हम प्रैक्टिस टेस्ट का रिमेनिंग पार्ट कवर करेंगे जो रह गया था। सो इंशाल्लाह आज हम उसको प्रॉपर्ली कवर करेंगे। सो लेट्स स्टार्ट। ओके, सो वी आर गोइंग टू स्टार्ट एंड द फर्स्ट MCQ इज द olecranian process is found on the humerus tibia radius ulna. Option D is correct, ulna. And the next MCQ is blood carries carbon dioxide, metabolic waste, oxygen, all of the above. Option D is correct, all of the above. Blood carries all things. The next MCQ is in mild head injury, Glasgow Coma scale score is. Option C is correct, 13 to 15. A physical therapist evaluates a patient who has a burn of the right elbow. The therapist should note what key measures at the elbow. So therapist should note the range of motion. Option A is correct, range of motion. MCQ 34 is common features seen in Bell's palsy patient include the following except D. Option D would be the right answer. Tongue deviate to the affected side. The next MCQ is joint can withstand the most compressive force. So ankle joint withstand the most compressive force. Option D is correct. Ankle joint. Okay, so the next MCQ is from the following in which stage of paraplegia is there no activity below the level of lesion immediately after the injury? Option A would be the right answer, stage of spinal shock. The next MCQ is inability to perform rapid alternating movements in cerebellar lesion is known as. Option B is correct, dysdiadochokinesia. Which test is carried out for testing the hip deformity caused by iliotibial band? Option B would be the right answer, Auber's test. So the next MCQ is a physical therapist is seeing a patient who is lacking terminal right elbow range of motion. What type of orthosis is appropriate for this patient? Option D would be the right answer, corrective. So the next MCQ is which progressive resistive exercise would function to strengthen the infraspinatus and teres minor? Option C would be the right answer, lateral rotation of the shoulder with elastic tubing. MCQ's next 41 is renal calculi are. Renal calculi are, option C is right, kidney stones. The pathology starts in, option B is correct, synovial. Pathology always starts in synovial. So the next MCQ is cancer is a disease that can be spread through, option B is correct, lymphatic and blood system. So the next MCQ is a patient presents to physical therapy with a complaint of pain in the L5 to S1 are with no radicular symptoms. Palpation and range of motion assessment of the lower lumbar spine do not reproduce any of the patient's symptoms. What other musculoskeletal structure can refer pain to the lumbar spine? Option A is correct, T12 disc. So the next MCQ is calcification of menisci is seen in, option B is correct, pseudo-gout. We will do the next MCQs in my upcoming videos. So stay connected till then and thank you so much.